I'm a refractive and corneal surgeon, so I work in Midland in Solihull privately, but I'm also a full-time NHS consultant as well. So I work in BMEC in the centre of Birmingham. It's a regional centre, loads of complex patients, and I'm also working sometimes in Birmingham Children's as a paediatric corneal specialist. So I have a wide breadth of experience in cornea and refractive. Dry eye is a very common thing for me to deal with, simply because it's my speciality as well. So dry eye disease, ocular surface disease, is involved with cornea and refractive. And the majority of my private patients come in with some element of dry eye, whether they're symptomatic or not. Especially when you think about doing some kind of surgery with them or some kind of intervention, you have to assess for dry eye. So dry eye management is involved in every single patient I see. And it's become more common since COVID. I'm seeing more and more dry patients. So the people who come in with dry eye are increasing every time, on a monthly basis. So that's something I always teach my colleagues and other doctors. It's so important to manage dry eye before you do any refractive surgery. If they have dry eye, you need to treat it, and then you need to repeat the measurements again. So I do measurements before. If they have dry eye, I do measurements again, and then afterwards I see the difference. And I check for dry eye again after treatment, make sure the dry eye treatment's working, and then you could see huge changes in topography, tomography, biometry. So to me, it's an essential thing to do. Okay, so the idea behind cross-linked sodium hyaluronate is to, ideally, I think, retain the drop longer on the surface. So we know about cross-linking because we do cross-linking for corneas. So I think the idea behind cross-linking hyaluronate is to make the component more stable on the tear film, create a layer, and last for longer. So the theoretical benefits of that would be to reduce the intensity or the frequency of the drop, and also furthermore to allow more comfort for the patient because it retains on the surface for longer. So that's my understanding behind cross-linked drops. Yeah, so I've been using the AEON Protect Plus for a while now. We give it before surgery and after surgery as well. Every dry eye person or patient is different, so they all like their own drops, or they have certain combinations that they prefer. But when you try AEON, I've had very little feedback, negative feedback. Obviously, some patients will like it as a combination with other things. We need to address the evaporative component as well sometimes. And then furthermore, I've not had anyone have any reaction to it or anything. So some people aren't really that used to using dry eye drops anyway, so you give it to them for the first time before and after surgery. So they don't know any difference. So that's my understanding of how the AEON works in my practice.